This virus is actually a novel coronavirus. In the past, there have been two other mutated coronaviruses which have caused pandemics. One was the SARS, which was in 2002, and the other was the MERS, which was in 2012. To give you a comparison, the SARS, or the severe acute respiratory syndrome, had a mortality of 10%. The MERS, which is the Middle Eastern respiratory syndrome, which came out in 2012, had a mortality as high as 35%. Now, the current SARS-2 coronavirus, which causes the COVID-19, has a mortality in 2 to 3%, probably more likely 1.5 to 2.5%. Now, if you need to compare it with the common flu or the H1N1 or the influenza A, the information available so far tells us that this is probably a little more infectious than the flu. When we say infectiousness, we use a terminology called the R0, whereby we refer to what are the chances of an infected person transmitting it to others. And the chances of one infected person with COVID-19 can transmit it to about 1.5 to 2.5 people. To give you perspective, measles, if one person can get it, is likely to infect anywhere from 12 to 18 people, and chickenpox, one person can infect to another 6 people. So that tells us that measles is highly infectious, and chickenpox also, and compared to that, the COVID-19 infection, the infectivity is much lower, only 1.5 to 2.5, and the regular flu is infectious probably in the region of about 1.5 or so. That the incubation period for this COVID-19 is a little longer. The flu, generally the incubation period is 2 to 4 days. Here, an average of 4 to 5 days is the incubation period, but can be as long as 14 days. Also, flu, the persons have fever, body pain and cough, which is also quite often seen with this. But in flu, we also have a lot of people have upper respiratory symptoms, which is less often seen with COVID-19. It has been shown that almost 3% of people with COVID-19 have diarrhea, which is a little more often seen when we compare it to the regular influenza A. Practical message is COVID-19 and flu are similar in terms of how they are acquired, which is through respiratory droplets. The mortality is a little higher. With this, the mortality is in the region of 2 to 3%. Now, the disease corona SARS-2A COVID-19 is a self-limited condition. Almost 80% of infections are mild. Another 15% may require hospitalization for oxygen and other supportive measures. 5% of people, that is 1 in 20, may end up in the ICU requiring ventilatory support, out of which about 2 people may die. Those who die over the age of 60 or people with other comorbidities like diabetes, heart lung disease or kidney disease. Mortality can be as high as 15% in people over the age of 80. At present, if you develop symptoms, we advise home quarantine in 2 situations. One, if you have come from a country where there is a local transmission of this infection, like in China, Iran, Italy, Germany, France. So if you are coming from any of these countries, you don't have symptoms of fever or cough, you come to India, for the next 14 days, it is advised you stay in home quarantine. That you need to stay in a separate room, which is well ventilated with the doors closed. The person should not entertain any visitors, and family should be at least 1 to 2 meters away, the distance apart from this person at all times. The person should not leave the house, should not go any social gatherings, which means he should be isolated. The toilet which he uses dedicated for this person alone, but if you don't have facilities, he can use the general toilet after the others use it. This person should wear a blue triple layered mask at all times and preferably hand wash or use hand sanitizer frequently. It is also necessary that the mask which is worn by this person should be disposed of in a bin and ideally should be incinerated or subject to deep burial once used. A person can use the mask generally for 4 to 5 hours, beyond which it may become moist and become ineffective. At present, there are a lot of people who present either after they have come back from a country where it is prevalent but don't have symptoms, or there are some people here who have symptoms but no exposure to a proven individual with COVID or exposure to any countries where COVID has occurred. The tests are done only in government centers and the public health machinery decides who needs to be tested. And the test is currently reserved only if you have come from abroad and are symptomatic, or you are symptomatic with exposure to a proven COVID-19 case in India, which means if you are anxious or if you may have symptoms of fever, cough and cold with no history of exposure to a patient or no history of travel, the test will not be done. But at present, the public health department decides whether you need to have the test done, and they are reasonably strict and go by the WHO definitions, which means that you either need to have been in a country where it is prevalent and come to India within the last 14 days, or you must have been exposed to a proven case of COVID-19. There is a lot of wishful thinking that the heat will kill the virus once the summer sets in. Now, I am not very confident about this. The virus survives very well at the body temperature of 37 degrees. And if I cough or sneeze and another individual inhale it directly, temperature outside is immaterial. It goes directly from one person to another. But if I cough or sneeze on a substance or an inanimate object where the ambient temperature is very high, more than 30 or 35, the chance that this virus will survive is possible. In a hot temperature, ambient temperature, if it falls on an inanimate object, it will dry very fast. So transferring from one person to another through a medium will be less likely. But having said that, we need to realize that most of the transmission happens indoor where there is air conditioning. So all of us need to take adequate precautions. Only outside where the temperature may be hot, the virus may not survive for long, and this may probably take the edge of transmission in the outside environment. Flu vaccine is only protective against the circulating strain of flu, because the flu vaccine virus is also very mutable virus or keeps changing. Every year, depending on the circulating strain of the flu virus, you need to take your vaccine as a booster every year to prevent yourself from getting flu. This has no connection whatsoever with the SARS virus, and this will not help protect you against the COVID-19. Based on our experience in the past several decades, in general, if you get a virus infection of a specific strain, you get lifelong immunity to the virus, whether it is chickenpox or measles or mumps. Now, there is no scientific evidence, but I would expect that for this strain of SARS-CoV-2 or the COVID-19 causing virus, if you get the infection once, you should have immunity which probably will last a lifetime. Similarly, if you have a vaccine specifically targeted against this strain, you should get immunity. But whether the virus may change in subtle manner which can cause a person to be reinfected, we have to wait and see. If there is local transmission proven, for example, in India, we start getting people who have never been exposed to a proven case of COVID being tested and proven that they could have this COVID-19, it means that we have to be careful. The general advice: avoid non-essential travel, crowds, do not wear a mask outside. If you have symptoms, wear a mask and stay indoors, self-quarantine. Even if you are not sure it is COVID, avoid crowds. Wash your hands frequently or use a hand sanitizer, especially in public places, and avoid taking your hands near your face. So civic sense and personal responsibility is paramount at this point. If it means social isolation, yes, so that we don't spread the virus, especially old people who may not fare well. Thank you.